Good afternoon, everyone. It's lovely to be here, and I'm really glad that we've got this time together to talk about something that is so important. And really, I think when we come together and reflect about what we can do better, I think that's when change really happens. So I'm going to talk about stigma and discrimination in Europe. First of all, just reflecting about stigma and exactly what we talk about when we think about stigma. So stigma is a complex social phenomenon, and there are many definitions of stigma, but one of them involves distinguishing people based on social statuses such as attributes, illnesses, and identities, and socially devaluing, discrediting, and excluding individuals with those statuses. And we know, and why we're here, is that HIV remains a highly stigmatized but also misunderstood health condition, and it undermines all we do within the sector and is one of our greatest challenges. And for me and for many of us here, I'm sure we all agree, is that it is a clear social justice issue. And when we think about stigma and we think about the ways in which it manifests, there are many different frameworks. But when we consider it, we need to think about internalized stigma, interpersonal stigma, organizational, societal, and also public policy as well. Now, HIV disproportionately affects those groups that are typically stigmatized in society. And when we think about stigma, it's really important that we recognize the socio-structural factors and the social determinants of health that impact both HIV transmission and also HIV-related stigma. And we can't help but recognize that HIV-related stigma is closely related to societal power structures and frameworks. And often in an individual, there are intersectional stigmas. So essentially, there are multiple stigmatized identities that are present in an individual that intersect and overlap and become multiplicative in their impact on that individual. And it's recognizing these intersectional stigmas that are crucial in our management as well. So I'm going to talk about London's response to exploring stigma in HIV, and then move on to a wider European experience as well. So the City of London made its commitment clear to be one of the first cities, or the first city globally, to get to zero. And one of the greatest challenges is stigma. And so the Fast Track Cities London spearheaded a systematic collaborative approach to tackling stigma. And I'm speaking on behalf of many colleagues, some here today, that have been part of this stigma subgroup. And it was obvious that there was a clear need for impactful interventions that would make a difference. But to do this, it was crucial that we needed to understand where we were starting from to co-design these initiatives. And so when thinking about this path to achieving zero stigma, it was clear that there was a dedicated action plan that was needed to be informed by real-time evidence. So what was the response? Well, in early 2019, dedicated funding was identified and a stigma working group was formed. And first of all, there was a pragmatic review of the evidence to date to inform the work that we were going to do. And then there were three key areas of focus that were proposed. So thinking about internalized stigma and how that was going to be approached, stigma within the NHS and other public services, and societal stigma. And I'm not going to talk about the other features, but they're really important and fantastic work that's been happening. So related to internalized stigma, there was a creation of an empowerment program which had been shaped by a community of practice. For stigma in the NHS, we're in the midst of developing a HIV-friendly charter, but I'm focusing on the societal stigma response, which was to commission a survey to set a baseline on public knowledge and attitudes to HIV. And this is just an outline here, but just to note that we started in early 2019, but we're all very aware of what happened in between. COVID did impact the timing, but I'm happy to say that in January 2021, the National AIDS Trust and Britain Thinks were commissioned to develop this survey, and the results were published in July 2021. Here it's over there. And so in terms of the methodology, it included a number of community stakeholder consultations, exploratory focus groups, the survey itself, and then follow-up deep dive focus groups to reflect on the insights that were given. And so just thinking about some of the key outcomes, over 6 in 10 reported not having heard anything about HIV in the last 6 months. And when people had looked at that, they reflected on TV programs, social media, online news, etc. But they were most likely to have not heard anything in the last 6 months were those that were aged 65 and over, non-Londoners, white and South Asian people, and those in rural areas, amongst others. Another key outcome was that only 1/3 of Londoners said they had sympathy for people living with HIV, regardless of how they acquired it. And so people felt that if they were going to have more sympathy for people living with HIV, were those that were LGBTQ, or those that personally knew someone with HIV, Black people compared to white and South Asian, and women compared to men. And another feature that was reflected within the survey was public awareness of U equals U. So public awareness was low, and with a majority still believing that it was false and that effective treatment prevented transmission. And for many of us here, and we're going to be reflecting about U equals U in a follow-up discussion, but it's really a strong reminder that within our sector, we do a lot about reminding about U equals U. We have many discussions about it, but the key is that do wider society, are they aware of it? And the survey suggested not. As I said earlier, and as is reflected here, and as when we're thinking about the outcomes of the survey, HIV stigma is complex, but 3 key themes emerged from the survey. So themes that the perception that acquiring HIV is associated with quote-unquote taboo behaviors, including condomless sex, promiscuity, and intravenous drug use. It was clear that there was a low knowledge of transmission, treatment, and outcomes, and there were persistent negative attitudes towards the LGBT community who were closely associated with HIV. And following on from this survey, across Europe, a follow-up survey has also been done, and I'm pleased to say that I've got the honor of presenting some of the preliminary results, and these are really hot off the press, and they were just presented at EX Standard of Care meeting last week. But the European Centre for Disease Prevention and Control, European AIDS Treatment Group, AIDS Action Europe, together with the UK's National AIDS Trust, which worked on the UK survey, commissioned the first ever European-wide HIV stigma survey. And this was exploring the experience of stigma amongst people living with HIV across Europe and Central Asia. And so what were the key insights? So first of all, this survey was carried out between November 2021 and January of this year. And there were over 3,000 responses from 54 countries. And when we look at the breakdown there, we had 80% men, of which 0.5% were trans men, 16% women. Of these, 17% were trans women, 3% were non-binary or identified in some other way, and 1.5% did not respond in terms of their gender. And 68% identified as lesbian, gay, or bisexual. And when we look at some of the preliminary results, the overarching outcome for me is that people living with HIV in Europe are as likely to have experienced stigma in recent years as a decade ago. And this is particularly in healthcare settings. And it really raised the concept of anticipated stigma. So, and this is a distinction that someone can perceive stigma, someone can experience stigma, but also people can anticipate it from previous negative experiences, will think that they are going going to be experiencing stigma. And actually, that anticipated stigma can be as powerful as experiencing stigma in itself. And then when people were questioned whether they were ashamed of their HIV status and if they had low self-esteem because of their status, 27 to 28% of people agreed or strongly agreed with both questions. And 40 to 49% disagreed or strongly disagreed with them. And there was also a concept of isolation which came through, in which 17% of respondents saying they had not even told one friend about their HIV status. So as we advance to zero, it's really key that real-time evidence is so important to really recognize that stigma is prevalent, but also to give us insight into the key drivers that we need to tackle as we need to step into action. And it's really translating the key learning from these stigma surveys into an action plan to mitigate or eliminate stigma. And I think that all of us will really also agree the importance of coming together for defined metrics of success. And some of these may be, in terms of our next action, could be with healthcare provider surveys and the charters that I've mentioned previously. But two of the key themes that have come out of this and are the sources of our focus and reflection today is the use of language, and the use of language amongst ourselves and wider society, and also the importance and power of the U equals U messaging, but also reflecting on both the positives and negatives of that. And I'm really happy to say that we've got great panels today that we're going to discuss, reflect with all of you here today, with all of you virtually, to think about what we know, to think about what we don't know, and think about what we need to do next. So as I end here, I want to really acknowledge the Fast Track Cities Leadership Group and the Fast Track Cities Stigma Subgroup, all that are highlighted there, and the National AIDS Trust and Britain Thinks, who commissioned the survey. Thank you all so much.